What's going, guys? I'm Dr. Nestor Marquez from Grace Dental Studio & Co. in Los Algodones, Mexico. And if you're looking at this video, it's probably because you're wondering what you're gonna do with your teeth. You've heard it all, you've heard it all on 4, full arch, all on X. There's a bunch of different names for it. You know, the age-old question of like, what is all on 4? What is this procedure? And if I had to describe it in a nutshell, we do this procedure for people that have reached the end of the line with their natural teeth. There's not a root canal that will save your tooth. There's not a deep cleaning. There's not a whitening that will save your teeth. It's the end of the line. It's terminal dentition. And because it's terminal, then you get the remaining teeth pulled out. Or if you don't have teeth anymore, we open a small incision in your gums, we expose your bone, and into your bone, we drill these basically screws. They're just like a screw, except they're highly treated and sterile and obviously very scientifically advanced, that they'll integrate into your bone and become one. And on these screws, we fix a prosthetic. And this prosthetic is amazing. It works. It's been proven to work for many, many years now. Here in our practice, it's become kind of the top-notch procedure. If you don't know, we travel the world teaching about this procedure, and we've been lucky enough just to be in the so-called dental tourism capital of Mexico. Everybody comes to Los Algodones, MOLAR City, to get dental work or dental implants. And here we are, and let me talk to you a little bit about it, okay? I am really happy that you're looking at this video before coming to Mexico, or even maybe you're not coming to Mexico, maybe you're getting this done in your country, and that's okay. But it's very important that you look at this video, because I'm gonna hopefully tilt over a few sacred cows of what it means to get dental implants. What do? We restore function. First of all, I feel like that's the most important thing, restoring function. There's people that can't eat properly. You can't bite into a steak, you can't bite into an apple, and those are all things that I feel like as humans, those are essentials. You have to be able to eat, And obviously aesthetics is up there with that redemption story, you wanna be able to smile. It's funny, but we encounter so many cases weekly of this procedure, and it's wonderful to be able to see the stories behind the people that come and they smile like this, or they or they don't smile, or they just, their resemblance, just their psychology behind not being able to smile just puts you into this depressive state of being, And when our patients, even after surgery, walk out here with a smile, it's just so fulfilling as a professional, but also as Grace Dental Studio & Co. Your lifestyle gets renewed. It's super important to have good teeth, functioning teeth, and beautiful teeth. End of the line. That's it. All right, guys, what do we need from you? If you're coming to Mexico, or if you're traveling to get this dental work done, what do we need? I love when my patient can send me a computerized a CT scan. They can send me blood work to make sure you're doing okay, because those things kind of get ahead of us, If you're coming to Mexico, we want to know that you're healthy enough to get surgery, and if you are, then everything is much better. Also, if you can, do send us the list of medications you take. It's not uncommon for people to have a huge list of medications, and unfortunately, some of those medications can be contraindications for you getting surgery. So if you do have a big list of medications, please be sure, as you're contacting us, to send that through. All right, well, the day of surgery comes. It's usually 3 days. The first day we talk, we get to know each other. The second day is your surgery day, in which we put you to sleep. Surgery, each arch, if it's the upper arch or the lower arch of both arches, usually take around 1.5 to 2 hours per arch. After the surgery is done, there's 2 things that can happen, and this is super important. I tell this to my patients in every consultation. You get to know this before coming. There's 2 ways this goes, guys. This is the most important thing. Listen to this. Most patients, most 95%, 98% of patients get something called teeth in a day, immediate load. It's the best thing. You walk out of here with something fixed that doesn't move, that feels like a final. That's what I want. That's probably what you want. That's what everybody wants. Unfortunately, it depends on the surgery. It depends on the quality of your bone, Sure, there's different type of implants that nowadays can help us with that, but the safe area, the safe zone, the less risks is doing conventional implants, not zygomatic implants sometimes, which I got nothing against, just not those. And you walk out of here, hopefully with a big set of teeth. But there is a possibility, guys, that you might need to walk out of here with a set of dentures.
Blow it out.
And it's only temporary, you know, it still looks like teeth. They're just nobody's cup of tea. And if you have to get dentures, oh well, the process will come to an end 3 to 4 months later. People ask me all the time, well, what about the pain? Is this super painful? You know, if you follow me on Instagram at Dr. Ness, you'll see some of the things I post there and they look a little scary. Now, if you don't want to look at those, don't follow me on Instagram. It's more of a professional Instagram, you know, I share it for other doctors around the world. But I have patients every now and then that look at those cases and some of them like that, you know? So it looks painful. I'll say this, it's uncomfortable. Usually 99.9% of our patients are like, you know, I'm at a 1, I'm sore, it's uncomfortable, you know, the recovery, just like any other surgery, there's a recovery stage, and once again, recovery is nobody's cup of tea, you know? We do give a wide spectrum of good painkillers that will keep you, you know, feeling okay as you heal. It's probably, I would say, a week of discomfort. Some patients, you know, depending on your pain threshold, could be a little more than that. All right, guys, so a very highly asked question is, what if I don't have enough bone? And that's a fair question. A lot of patients come and they've been wearing dentures or they've had bone loss all their lives and you got to this procedure a little too late. What happens then? Are you not a candidate anymore? Has somebody said, you're not a candidate, I'm sorry, but this is not for you? Fortunately, we are in a place in science and the evolution of dentistry where there is different types of implants that might fit the scenario. That means zygomatic implants, transnasal implants, transsinus technique implants, pterygoid implants, and these are all things that we do here. They just take a little bit of more planning, so to say. But if that's your case and if this video was helpful, please leave a comment down below in the section. We'd love to hear questions, guys. I want to do more of these videos to inform patients of what they're getting into. So yeah, please, maybe we'll do a video of like mythbusters, you know, like things that patients don't know, but you need to know. Anyways, guys, Dr. Nestor here. I hope you guys are having a good day. If not, get your teeth fixed. See ya.